All right, team, we have a patient presenting with parafolliculitis, tonsillitis, and orchitis. Let's brainstorm possible diagnosis.
Could it be something like sarcoidosis or Behçet's disease?
I think it might be a rare condition like Schnitzler syndrome.
What about Sjogren's syndrome or even lupus?
No. It's definitely Schnitzler syndrome. We need to act fast. All of you, prepare for a lingual frenectomy on the patient.
But that's a risky procedure, Hawks. Are you sure about this?
I've never performed a lingual frenectomy before. Are you certain that's the right course of action?
This is insane, Hawks. You can't be serious about this.
I don't give a damn what you think. We're saving this patient's life no matter the risk involved. Get ready for surgery now. You called me in, Tracy?
Yes, Hawks. I heard you want to perform a lingual frenectomy on your patient with suspected Schnitzler syndrome.
Yes, I believe it's necessary based on my diagnosis and experience.
Hawks, are you sure about this? It's a rare syndrome and a delicate procedure.
I know what I'm doing, Tracy. I've been in this field for years and I trust my instincts.
I understand your confidence, but we need to be cautious with such complex cases.
I don't need to discuss further. My patient needs this procedure and I'm going to do it.
Hawks, I respect your experience, but we need to consider all options and risks before moving forward. Let's have a thorough discussion about the best course of action.
I can't believe you're questioning me after all these years, Tracy. I know what's best for my patients.
Oh no, this is not good. How am I going to tell Hawks about this? The lingual frenectomy was definitely not the right treatment for Schnitzler syndrome. I should have double-checked before proceeding with the surgery. I need to figure out a way to break the news gently. Hawks is not going to take this well. I just hope we can find a better solution quickly to help the patient. Time is of the essence.
What the hell were you thinking? You almost killed that patient with your incompetence.
But Dr. Hawks, we thought...
You thought wrong? You chose the wrong lingual frenectomy and misdiagnosed the condition entirely?
We were just trying to...
I don't want to hear it. You three are a disgrace to this hospital. I can't believe I trusted you with such a simple procedure.
Maybe the diagnosis was...
Shut it, Frank. You're just as clueless as the rest of them. I don't know why I even bother with you idiots.
We'll do better next time, Dr. Hawks. We promise.
I don't want your promises. I want results. Figure out the correct diagnosis before someone else gets hurt. I'm done with all of you. Chalk storms out of the room, leaving his diagnosticians looking ashamed and uneasy. I can't believe I haven't figured out what's wrong with this patient yet.
Maybe you're just having an off day, Hawks. Have you considered checking the blood work again?
I've checked it multiple times, Johnson. It's just not adding up.
What about running some additional tests? You know, sometimes the answer is right in front of you.
You might be onto something, Johnson. I'll look into it further.
See, I told you I could help. Now finish your sandwich before it gets cold.
Suddenly he stands up.
Hey, where are you going? You didn't even finish your lunch.
I just figured out what's wrong with the patient. Thanks for the suggestions, Johnson. I've got to go take care of this. Goodbye. I've got it. Schnitzler syndrome was a misdiagnosis.
Hawks, what are you doing here without the proper gear? You can't just storm in like this.
This is unacceptable, Hawks. You need to respect the operating room protocols.
We can't proceed like this. You have to leave and come back prepared.
No, you don't understand. It's macrophagic myofasciitis, not Schnitzler syndrome. This changes everything. I finally got the right diagnosis for the patient.
Congratulations, Hawks! But let's not forget that the wrong diagnosis almost cost the patient their life.
If you had just listened to me from the start, we wouldn't have been in this mess to begin with.
I had valid reasons for my initial diagnosis, Hawks. You can't just blame this on me.
Valid reasons that nearly killed the patient. You need to start trusting my expertise more.
And you need to follow through on your investigations instead of jumping to conclusions. It's a team effort, Hawks.
Well, maybe your leadership isn't as great as you think it is, Tracy.